Hello everyone, my name is Nikhil Tanaji Jadhav. I am second year MBBS student at DUPMC Jalgaon. So today we have to learn drug dosage forms, and in that also we have to learn the oral dosage forms. So at the end of this is a practical session. So at the end of this practical class, the learner should be able to list the common solid forms used to oral route of administration. Second, we have to learn here that the instruct the patient about the correct method of using the dosage forms. So these two are the points that we have to learn in today's session. So first thing, what are the dosage forms that we have to know? So dosage forms are specific formulations in which medications are prepared for administration to the patient. They are designed to deliver the active pharmaceutical ingredients, that is also known as APIs, in a safe and effective manner. So dosage forms are classified according to route of administration into oral dosage forms, parenteral dosage forms and topical dosage forms. So dosage forms are of three types that we have to remember here. That is that oral dosage forms one type, next is parenteral dosage form is another type, and topical dosage form is a third type. So our today's main topic is the oral dosage forms, so that we have to learn. So oral drug dosage forms are medications that are intended to be taken by mouth. Simply, oral means mouth, and the medications or the drugs that we have taken by our mouth or through the oral route, that are known as the oral dosage forms. They come in various forms such as tablets. So the various forms that we have taken the oral dosage forms are tablets first, next one is capsule, third one are liquids, next suspensions, and are designed to be swallowed and absorbed through the digestive system. Obviously we are taking through the mouth, so they are to be absorbed in our digestive system. So these are convenient for many patients and allow for accurate dosing. Next are the types of oral dosage forms. So liquid dosage forms are mixtures, syrups, oximal, tincture, spirit and elixir. These are the types of some of the liquid oral dosage forms. So first one is mixture. So a mixture is a liquid medicament containing dissolved, suspended or emulsified substances in a suitable vehicle for internal use. Mixture are of three types. Which are the three types of mixture? First one is solution, second one is suspension and third one is emulsion. So these are the three different forms or three types we can say of the mixture oral dosage forms. So second one is solution. Solution is a homogeneous mixture composed of two or more substances where one substance, that is the solute, is uniformly dispersed within another substance, that is the solvent. Means in the solution what we have to do, there is a one solute and one is a solvent. So solute must be dissolved in the solvent. So types of solution, which are simple solution and complex solution. If you have to take the examples of some simple solution, then that are ORS, then ferric ammonium citrate mixture. These are the some of the example of simple solutions. Next one is complex solution, and the examples of the complex solution are mixture of iodine and camphor alcohol. These are the examples of the complex solutions. Next one is suspension. A suspension is a liquid medicament containing insoluble substances which are homogeneously distributed throughout the vehicle with or without the help of suspending agent. So this is the definition of suspension. So suspension contains two substances. First one is diffusible substance or also known as non-diffusible substances also. Second one is suspending agents. So what is the suspending agents? Suspending agents are also known as suspending agents, or suspending agents are substances added to a liquid formulation to prevent solid particles such as powders or granules from settling at the bottom of the container. This is the definition of suspending agents. Next one is emulsion. So what is emulsion? An emulsion is defined as a system of two immiscible liquids, one of which is finely divided into small globules and dispersed into the another with the help of emulsifying agent. So this is the simple definition of emulsion. So emulsion also containing three components in it. What is first? So one is continuous or dispersion medium, second one is discontinuous or dispersed medium, and third one is emulsify agent. So these are the three components of emulsion we can say. So type of emulsion, So here we have to differentiate between oil in water emulsion and water in oil emulsion. So first point in the oil in water emulsion is water is the dispersion medium in oil in water emulsion, whereas if you consider water in oil emulsion, there is a oil is in the dispersion medium. So this is the main difference we have to consider here. Second difference is oil is in the dispersed phase, in which oil in water emulsion, whereas if you consider water in oil emulsion, water is the dispersed phase. Third point is non-greasy and easily removable forms of the skin surface. Here greasy and not water washable. Fourth point is used externally to provide cooling effect, for example vanishing cream. Here it is used externally to prevent evaporation of moisture from the surface of skin, for example cold cream. Fifth point is water soluble drugs are more quickly released from emulsion, whereas oil soluble drugs are more quickly released from emulsion. So these are the some of the points, or we can simply say comparison between oil in water emulsion and water in oil emulsion. So now next point to be covered here is emulsifying agents. So emulsifying agents, also known as emulsifiers, are substances that facilitate the mixing of two immiscible substances. Okay, once again, emulsifying agents are also known as emulsifiers, are the substances that facilitate the mixing of two immiscible substances. So examples of the emulsifying agents are, first one is gums, second one are the soaps, third one are the proteins, and fourth one are the carbohydrates. These are the examples of the emulsifying agents. Next one is solid oral dosage forms. So up to now we have covered almost all liquid dosage forms, liquid oral dosage forms particularly. Now we have to compare, or we have to study solid oral dosage forms. So solid oral dosage forms refers to the pharmaceutical drugs formulation that are intended for oral administration in a solid or semi-solid state. So that is the simple definition of solid oral dosage forms. Next one is powders. In that also, what is a powder? So powder is a solid dosage form mainly which contains one or more ingredient mixed with each other in a dry and finely divided states. What is a powder? Once again, a powder is a solid dosage form which contains one or more ingredients mixed with each other in a dry and finely divided states. Powders are of two types: simple powder, compound powder. So compound powder, the best example of the compound powder is ORS powder. Next is advantages of powders. What are the advantages that are of powder dosage forms? So first thing is it is inexpensive. Second thing is dose can be weighed out accurately. Third one is easy to dispense even in multiple doses. Fourth one is powders are suitable forms of administration for insoluble salts which are in mixture. These are the four simple advantages of powders. So from this we have completed our topic. So let us begin with some MCQs. So MCQ number 1, what is the primary purpose of enteric coated tablets? So we know that some of the tablets are covered with when we are taking it orally. So what is the purpose of it? That is asked in the question. So first one is option A, rapid drug absorption. Second one is test masking. Third one is protecting the drug from stomach acid, and fourth one is increasing drug solubility. So correct answer is option number C, that is the protecting the drug from stomach acid, because many drugs, due to the high stomach pH of the stomach acid, that are destroyed in the stomach. That's why we have to protect them from the stomach acid. Next one is MCQ number 2, which of the following is not a type of solid dosage form? So tablet, option A, B syrup, third capsule, and D lozenge. So answer is syrup. So from this we are completing our today's session. Thank you so much.